All right, here we are with a better close-up view of what's going on with the actual spine during the procedural protocol known as Flexion Distraction. So what we have is a patient laying face down. If you can visualize this here, head is up and through here in the headrest paper, mid back here, low back here, right? And remember that disc herniation, I know it's hard to see from where you guys are at, but remember that disc herniation, when it pops out, is going to pop out either posterior or laterally towards the left or towards the right. So a lot of patients that have sciatica, for example, they'll tell you, man, my low back hurts, but man, my leg is really on fire down that right side or down that left side. The reason is the disc typically will go posterior or back and hit the nerve root, sometimes more on the right, sometimes more on the left, depending on the actual injury. So this particular disc model over here is posterior right, so this patient would probably be having right lower extremity pain, whether it be to the groin or to the leg or to the back of the leg. So with that said, again here, more of a close-up view. What we want to do is we want to start to understand the process of how this actually works, right? So what we're trying to do with this herniated disc that's sitting in the middle here is actually distract this area apart. Because when we distract the area apart, the fluid from around that spine actually will flow up and back into the disc to rehydrate them, right? Okay, so that's the number one thing. And this is great because it's passive movement. A lot of patients with lower back pain, they can't get up off the couch, or they can't go run or exercise or get that pumping action that actually helps those discs. So again, that double-edged sword type thing goes into effect there. So what we want to do here is let's show you a little bit of how the table works. Again, patients are typically laying face down so that they have a grip up. There's actually grippers in the front of the table here to kind of keep the upper body position here, all right? And then what we'll do is we actually strap the feet in very, very lightly while they're face down here to get a good pull apart this direction. As the table turns on again, what we try to do here is get a little bit of pressure up this way as this table drops. And what you can see is as the table drops, that spine starts to actually open up and close back up just like this. And you'll see a little bit of pelvic movement there too if I keep a little bit of pressure down, right? So again, this is the procedure known as Flexion Distraction. We use this not only for disc injuries, but we use this actually for lower back patients as well. It's nice to get a good stretch down there too. Oftentimes it's difficult to stretch when you're bending over, and we'll get to that. There's some issues with bending over and stretching as well. But just trying to stretch that lower back is difficult sometimes when you're weight bearing or patients just aren't flexible enough to hit these deeper muscles that they need to get. So we use this procedure just with generalized back pain as well. It's safe and effective for that.